July 31st is Heat Stroke Prevention Day. As many of you know, it has been quite the hot month of July, and it's important to talk about heat exhaustion and heat stroke and how you could potentially save your own life and others right now with this intense heat. With us today is Patti Newton. She is a nurse practitioner at ChristianaCare Primary Care at Woodstown. Patti, thank you so much for joining us today.
Thank you for having me.
We talked off camera before we got started about how hot cars can get. We have this thermometer right now on the drive over here. It measured inside the car at 115, and right now it's measuring outside at 101.7. It certainly feels that warm out here, Patti. So let's put this inside the car, so during our conversation, when we circle back to car heat, we can really prove how hot it can get inside. So while I'm doing that, let's go over the difference between heat exhaustion and heat stroke.
Heat exhaustion is the beginning of the body's inability to regulate the exposure to the extreme heat. Heat stroke is when it goes a little bit farther and it becomes a life-threatening emergency.
So how do you differentiate the symptoms of those two things?
Heat exhaustion is more sweating a lot, very thirsty, maybe some nausea, maybe some vomiting, maybe a little irritable, maybe a little sleepy or tired despite being in the heat.
And what about heat stroke?
Heat stroke is more neurological signs, more confusion rather than irritability. The sweating and the skin changes. The sweating actually decreases, and the skin goes from a clammy to a reddened, flushed, more dry. We also could possibly see passing out or seizures.
So obviously we want to stop it at heat exhaustion. We don't want to let it get as far as heat stroke. So if we're realizing we might be exhibiting some heat exhaustion signs, what should we do immediately?
Get out of the heat. Go to a shaded area, get inside, consider taking off the clothes that are contributing to the problem, focus on rehydrating, and slowly, I say this cautiously, slowly trying to lower the temperature, meaning maybe some cool bath towels lying on top of the person. Do not do anything like plunging in an ice bath or anything severe. It's got to be a gradual reduction in temperature.
And at what point do you go from treating at home to seeing a professional?
I suggest, especially in regards to children, if there's any signs that are concerning, anything heat exhaustion, even if you think you're managing it well, it's scary. Please give us a call. Call your provider. We're always available, even if it's through answering service. Sometimes you just need that reassurance and you're fine, and we'll be able to tell you. Certainly if your child or your adult is not responsive or really acting very out of sorts, you need to call 911.
So it's only been a few minutes, but we're going to check the thermometer in the car. Being in the car for extended periods of time without air conditioning, specifically if you accidentally leave a child in the car, can be incredibly dangerous. Let's talk a little bit about that and why it can be so dangerous.
Well, it can be so dangerous because it even more quickly elevates that internal temperature. Because I'm sure that this is an elevated reading, and just imagine that effect that it would have on a small child.
So I referenced just a few minutes ago, it was measuring about 101 outside. Right now it is measuring 121.9. So just in those few short minutes, it's gone up 20 degrees.
Right.
So how can you prevent, sometimes accidents happen, you leave, anything behind in the car. How can you prevent that from happening?
Well, first of all, I think it's important to remember that this isn't always about somebody forgetting a child. Surely we're distracted. We all have lots of things on our mind these days, and accidents do happen. However, sometimes it's a matter of my kid's asleep in the seat and it's a pain to unhook it, and I'm just going to run in for a couple seconds and run this errand. So sometimes that unintentionally becomes a disaster as well. So some things to remind yourself of are, when you put your child in the car seat, I would suggest putting something in the front that belongs to the child to remind you, such as a toy or a stuffed animal. Conversely, you could put something of your own in the back seat that you will need to get out, like a handbag, briefcase, your phone, something like that.
When it comes to just heat exhaustion and heat stroke as a whole, what is the most important thing for people to remember?
You have to pace yourself. You have to not try to be the tough guy, and little bits exposure outside are good, but anything beyond that, you have to listen to your body. If you're getting warning signs that you're not feeling great, get out.
Patti, thank you so much for all of that information today. And if you need any more information on heat exhaustion or heat stroke, please visit ChristianaCare.org.